Hello and Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Ain Yusuf. I'm from Group 7 and our group consists of 4 students, which is me, Khalifah, Sarah Saada and Wan Rifqah. Our group's topic is pancreas malfunction. So what is pancreas? Pancreas is internal organ that produces digestive enzymes and the hormones insulin and glucagon. It is slender fish-shaped organ, stretches across the abdomen behind stomach, near duodenum of small intestine. So pancreas composed of two types of tissues, which are exocrine tissue and endocrine tissue. Exocrine tissue produces and secretes digestive juice that go by way of ducts to the small intestine, whereas endocrine tissue or pancreatic islets produce and secretes the hormones insulin and glucagon directly into the blood. So next we go on with glucose homeostasis. When there is a high blood glucose level, the insulin will be secreted and this insulin will stimulate the uptake of glucose by cells. For both liver and muscle cells, glucose is stored as glycogen, whereas in adipose tissue, which is the fat cells, the breakdown of glucose supplies glycerol for the formation of fat. So in these ways, insulin lowers the blood glucose level. Next, when the blood glucose level is low, the major target tissues of glucagon are the liver and adipose tissue. Glucagon will stimulate the liver to break down glycogen to glucose and to use fat and protein as energy sources instead of glucose. Whereas adipose tissue cells break down fat to glycerol and fatty acid. The liver will take this up and uses them as substrates for glucose formation. In this way, glucagon raises the blood glucose level. Next, we continue with diabetes. Damage to insulin-producing cells in pancreas from chronic pancreatitis can lead to diabetes mellitus, or commonly known as diabetes. It is a condition where body cells are unable to take up glucose. When that happens, it will cause blood glucose to be higher than normal, and cells need to rely on other fuels such as fatty acids for energy. Plus, as the blood glucose level rises, glucose along with water is excreted in the urine, and this will result in frequent urination and causes the diabetic to be extremely thirsty. Other symptoms of diabetes also include fatigue, constant hunger, weight loss, and vision problems. There are two types of diabetes, which is type 1 diabetes and type 2 diabetes. Type 1 diabetes is when the pancreas is not producing enough insulin, while type 2 diabetes is when the cells are unable to respond to insulin. For normal body function without diabetes, this is actually the same with glucose homeostasis that I explained just now, where insulin and glucagon act as antagonistic hormones. Both of these hormones work together to maintain the blood glucose level in a stable range. Okay, so this is a comparison between type 1 diabetes and type 2 diabetes. Imagine the insulin as the key to unlock the cell's door. For type 1 diabetes cell, as it doesn't have insulin, it means that there is no key to unlock the cell's door, so sugar can enter the cell. While for type 2 diabetes cell, even though there is insulin, which is the key, it can't unlock the cell's door as it doesn't fit, and the sugar cannot enter the cell as well. This is because of the body's inability to use the insulin. So this is a description for type 1 diabetes. You can see on the screen. Individuals with type 1 diabetes usually requires daily insulin injections to control the diabetes. The symptoms can become more obvious and develop more quickly, and it cannot be prevented, but many researchers are working to develop more effective methods for treating it, such as using an artificial pancreas or transplant a working pancreas, or even fetal pancreatic islet cells into patients with type 1 diabetes. Next, this is the description for type 2 diabetes. Individuals with type 2 diabetes may require insulin, usually hypoglycemic. The symptoms may be absent and develop more slowly, and most cases can be prevented by adhering to a low-fat, low-sugar diet and exercising regularly. The effects of diabetes are including eye disease, heart disease, kidney disease, nerve damage, feet damage, and it can be prevented by eating healthier and exercising regularly. The treatment that always be taken to treat this diabetes is by taking a medicine and monitoring blood glucose levels. For the interview session, we interviewed a person with diabetes who is Puan Wan Nur Asila binti Wan Mahmud, a former lecturer at University Malaysia Sabah. So let's watch the video.
For the first questions, I would like to ask you how long that you have had diabetes and what are the type of that diabetes?
Okay. I have had diabetes, type 2 diabetes since 2006.
It is caused by inheritance or environmental factor.
I don't think inheritance the cause of my diabetes because when I was pregnant with my youngest daughter, I gained weight that contributed to my having diabetes. I ate so much at that time and had no exercise.
For questions number 3, can I know what are the medications that you take and when did you take the medicines?
I only take insulin. The type of insulin is insurgent 30/70. They take 2 times a day, about 16 to 18 units per each times. It depends on my glucose level. If my glucose level rose to 18 millimole, I have to take 20 units of my insulin.
For the last questions, could you share what are the difference in your lifestyle after being diagnosed with diabetes?
My lifestyle, I have to watch what I eat. I have to avoid sugar as much as possible, and I have to eat a small portion of everything. There's a lot of things that I want to do, but I cannot do because I need to be careful not to cut myself or hurt myself. I'm afraid of infection and cannot heal very quickly.
Okay, so this is the summary of the interview, and there's also the summary of the content as well for clearer understanding on this topic. This is the list of reference that our group used to make this slide, and I think that's all from our group. Thank you.